mothers to be in today's time and age will be almost my children's ages. So I would say a young child who is becoming a mother for the first time needs that empathetic coordination. And that empathetic coordination will come from the family, mom-in-law specifically, other people in the family, doctors, nurses, healthcare people, and society by and large. So if it takes a whole village to bring up a child, it takes multiple villages to give birth to a child. And everybody needs to come together to support the cause. And generally, by and large, we are all very kind to a pregnant lady wherever we are. We are normally very understanding of their subject, and those who are not, they better be. And that's why the policies come in, that before the birth also women need enough, because that's also a time when women need support. Post-pregnancy also women need support. That kind of understanding has come into society, and we are one of the best served society which gives maternity care leave close more than 6 months, 9 months and things, and which no other society in the world gives. So as I said, India is a better place to bring up children, to give birth to children, because our social setup is so tuned towards maternity, and we must learn to appreciate. At times, in the modern life, again I call it lifestyle, we do not look at the positives in the way we need to appreciate. And that is part of training and articulation, where I think all experienced women, my age and younger, would agree that, look, we were able to do what we were able to do in our lives because there was childcare. There were people who were understanding of our position, and there were people, credited more to them, who understood us than ourselves. So if we appreciate that aspect, that's a good teaching to the young people who are going to be the mothers. This is the emotional aspect, and you all must understand, when a woman is giving birth to a child, the hormones change, her mental health also changes. So a positive atmosphere is got a lot to do with it. And she has to feel strong, she has to feel wanted, she has to feel comfortable, and that we as a society can provide. So that gap by society needs to be understood. If there is a older woman who's willing to take care of a youngster, that's the best. But if there is no one around, there are many nuclear families, there are many youngsters who are living off their own, and they have very difficult work life. Husband is posted elsewhere, wife is by herself. Not that she's a smart person, a thinking person, but if there is a gap at a particular moment when she needs to be with the doctor, I think people should come forward, and she should have that understanding that I can call so and so, a male colleague or a female colleague who will just drive me down to the hospital. Or this is what is likely to happen. Fazil in his remark mentioned, confusion, which doctor to go to, which hospital to go to. So I would say, where don't go by the fancy names, but go by people who are close in terms of distance, where driving time is less, and a doctor and a nursing care or a support staff who is compassionate, who you can look into the eye and can depend that the person will be taking care of you. Those are important factors, not the fancy names and the jet-setting lifestyle or sports car driving. I don't want to get into that conversation. So what I'm saying is that instinctively, women know how to care for the child. Instinctively. But there are certain books which are available. Not the Google Baba, but the books which are both pediatric care, especially because moms can be as confused. And sometimes the information available will be don't give gul, or don't give haldi, or don't give adrak, or don't give shahad, things like that. Very much available. So at that time, how much to give, when to start, how to check allergies, how to see the doctor's reactions, etc., etc. All this is part of bringing up children. And all this is part of even maternal care, because you need to understand what you could do before. When you're expecting, your chemical chemistry has changed. So the chemicals in the body have changed, and we are all laugh and say that we are a bundle of chemicals, and we forget that aspect. So since we are a bundle of chemicals, oxytocin which women produce at this time, memory glands which we have, are to nurture a child. So in that process, I feel lactating mothers also need to be told that lactation is important not only to protect the child but to protect yourself. So the conversation around this needs to change. I think the conversation usually is, oh, this is good for the baby, so please go ahead. You could leave in the fridge and the baby can be fed. If the circumstances are such, you got to leave, and then those are the possibilities. But by and large, feeding a baby is as natural for human survival as it is for any animal survival, as any primate would require. And I would request everyone to watch a small video which is doing round, and that has touched my heart because I related to the mankind. A small baby Punch who is roaming around with a doll or a return because the mom rejected him at the birth. Now, if a mother rejects a baby at the birth, what happens to that child is something which we need to tell the mothers. How important it is to hold the baby when the baby is born, and because it's been part of your body for 9 months and above. So it's you which has come in that form. It's not some external or foreign object. To feel that connect is as important for you as it is for the baby. So until unless we produce psychologically strong children, we will have a psychologically weak society. So that maternal instinct along with maternal care is so relevant at that time. They're holding a baby, transmitting that energy and transmitting the value system is all part of the cultural continuity. And if it can have an impact on primates, imagine what impact it will have on human beings. So keeping children away from mother is not probably the right thing to do. And even I have this debate with a whole lot of my friends in medical fraternity, not to question them, but just to put my point forward. Lactation or feeding the baby is important not only for the baby but for the mom. One, emotionally. Two, physically also. So most of the breast cancer cases, if you check the data, lactation is directly related to it. So I can give the number which is available in public view, but above 80% and cases are those which are because the women at the time of lactation have not fed the babies. So I will say start communicating that lactation time and feeding the baby is not only important for the child but it's important for your own health. Because if I have to subsequently treat myself for breast cancer, I might as well feed the baby because it's such a natural process. So science is one part, but cultural part needs to be respected. And when we have to respect cultural part, feeding moms is very natural for all of us. And we all have to provide, as a society, places where feeding, places where moms can have a bit of privacy and they can be taken care of. Their diet, their food. Now, on one side you say, oh, no, don't consume sugar because you're diabetic. At times you could be temporarily diabetic at this stage. So you need to explain. So I think one lot of communication is as much part of maternity as the actual care. Iron. I think we have 55% cases of iron deficiency. Uh, why should that happen? Because iron is something which is absolutely common in even earth and soil. Most common element we have after silica, iron is very easily available. At the same time, we are not able to bring the focus that all the old studies where lohe ki kadhai and the food needs to be cooked, taking iron, I mean anything iron based, green veggies or something with the nimbu on top, that had a science in it. So I feel that it's not just the supplements which will change us, but it is the ignorance towards science which we have brought into our system. So if Nani Dadi Mummy had told you anything is not unscientific. There was a reason for that. So when we are talking about healthcare and we are talking about allopathic doctors, my complete respect to the profession they are from and the kind of hard work they do. But I think the nuskhas, the cultural combinations, the geography we come from, the family traditions, etc., have equal role. And that needs to be appreciated by both sides, including the doctors. And that is as much part of science. And we have to bring a manual based on the geography, which I think the researchers, etc., will have to bring it forward, that there are good practices. In every culture, there are good practices which lactating mother, pregnant mother, nutrition, food value, how much calories do you need. The scientific aspect of culture needs to be brought forward so that women who are young, pregnant, can take benefit of that. Like good, for example, or there are different foods which are given. Even consuming desi ghee, which at one time was looked down upon, but today is the superfood. So there's a lot of science involved in it. And weight gain or weight loss is as much important for women who go through this process for their mental well-being. So I think a combination of factors where the scientific aspects need to be brought forward, healthcare needs to be taken care of. IMR, MMR, I think in terms of this also, we have done pretty well. We have, our rates have improved a lot because of the policy intervention and the manner in which we have done well. Even the girl child, the female feticide to an extent has been brought under control for past policies. So all these are very positive stories. At the same time, does not mean we take the focus away because we can always slide back. So if we understand the gaps, we need to work at those gaps. Vaccination. Vaccination program cannot be compromised and that has to be strictly brought forward. We've done away with maternal mortality rate to a very large extent. The maternal tetanus used to be very much prevalent. We have done away with this. Polio we have done away with. So a couple of things we have controlled totally, but the things which we have not been able to control, or we have not controlled so far, you'll be shocked to know that these are not communicable diseases, these are non-communicable diseases. High blood pressure, I think Azul or my friend was talking about it. Now high blood pressure is non-communicable. Why should people get high blood pressure? So the fact people are getting high blood pressure is stress related, is related to food. So yoga, taking care of our hormonal body, taking care of the chemical composition, again, holistic lifestyle. Many drugs which before the pregnancy people are taking for spacing, for so many other things, that detoxification needs to happen, that time needs to be given. Otherwise, you end up with IVF. PCOD, PCOS, so many things. Lifestyle, food, that needs to be taken care of. So I think we are on a good platform and I thank Times for having this conversation because some difficult words need to be spoken and this is an opportunity for us and especially the healthcare professionals who have to speak those difficult words. Families need to come together, workplaces need to come together, and policymakers need to come together with telemedicines, with availability of doctors, etc., WhatsApp. So many things are possible today, which were not possible for, say, my mom's time, your mom's time. So those availability of doctors, etc., was not there, but they lived a full life, they lived a healthy life. Learning from them, applying it to the present day, finding various methodology, but basically infrastructure, service. I think pregnancy and maternal care is a lot dependent on the service aspect. And on the infrastructure aspect, if we combine the number of doctors, both the Ayurvedic and allopathic, we meet the target numbers. So if we have a set protocols, if we work on those protocols, that this is the bare minimum which needs to happen. Even the Ayurvedic doctors and other doctors, Ayush doctors can come on board and follow those protocols and fill the gap, where the gap is. So rural-urban divide can be taken care of, and we will see successful maternities and successful society, successful generations which will take the country forward, and the dream which we started from of Viksit Bharat, and that Viksit Bharat will have healthy youngsters, intelligent youngsters, compassionate youngsters, and a society which learns to live with each other and helps each other. With these words, happy maternity to all those who are young pregnant mothers, who are still searching for answers. Please meet the doctors. Please sit with your elderly women in the family. Learn from the mothers who have been there, who've seen it, who've done it, and feel free to ask questions. Nobody is born right, and especially if you're a first-time mother, that's the first experience you have. And even if you are a second-time mother, second pregnancy need not be like the first pregnancy. Every pregnancy is every pregnancy is different, and every child to be is carrying a different genetic combination. So we have to start working together and wish the very, very best. And thank you all for touching a very relevant subject. Thank you. Jai Hind.
I would